Well, thank you guys for joining me today, and we wanted to give you an update on our fight against COVID-19. Before I begin, I wanted to express my condolences to the family of Tulsa Police Sergeant Craig Johnson. The First Lady and I just came from the funeral in Tulsa, and we continue to pray for his family and the recovery of Officer Arush Zakarshan. Oklahomans came together from all walks of life yesterday, and we ended up raising over $500,000 for the families of those two officers. I heard stories of so many Tulsans who stepped up to help their families, and one of the stories I heard was a guy that came through the line that was driving a garbage truck. This guy said he didn't have much money, but he wanted to support the officers in Tulsa. So he said he gave his money for breakfast and his money for lunch. And that just is an example of what Oklahomans do when we have community members and people in need. So we need to come together and put aside any differences. We need to approach our fight against COVID through the same lens, not as something to divide us, but as a common enemy to rally against together. We are now 77 days into our reopening phase, and we're 39 days into phase 3, our fully reopening. Since we reopened, 72% of our cases have been in those younger than the age of 50. In those 10,000 cases, there have been just 6 deaths. And I don't want to minimize any deaths, but just want to continue to give the transparent data to Oklahomans. That means a death rate under the age of 50 of 0.06%. While our cases and hospitalizations have been increasing the past few weeks, we are watching this information really closely and carefully, and we are managing our capacity. We still have the capacity of 5,000 COVID beds to be able to access throughout our state. And for example, we had 560 was our peak in hospitalizations on March 30th, 560. The day we started reopening on April 24th, we had 306 people in the hospital being treated for COVID. We have had almost 15,000 new cases since we started reopening on April 24th, 15,000 new cases, but our hospitalizations have only gone up 181. So today we have a total of 487 people in the hospital across the state of Oklahoma, and like I said, we have capacity for 5,000. However, our fight is not over. In order to protect the health and lives of Oklahomans and continue to mitigate the impacts to our economy, we need all Oklahomans to do their part. Last week, I directed the Oklahoma Health Department to develop a color-coded system so Oklahomans could continue to have transparent access to data in their communities. We know we will continue to see new cases of COVID-19. And this is going to be our new normal for the foreseeable future. This system, however, will show Oklahomans how to deal with this virus on a prolonged basis. So at this time, I'd like to turn it over to Commissioner Frye to give us an update. Commissioner Frye?
Thank you, Governor. In the beginning, Oklahomans came together and focused on delaying and flattening the curve in order to allow us to increase our capacity and not overwhelm our healthcare system. During this time, a very robust healthcare surge plan was put into place, which it included increasing hospital capacity, our stockpile of ventilators and PPE, and other critical resources needed to protect Oklahomans. Oklahomans worked together and followed the recommended guidelines, which allowed us to move into a phased reopening while carefully monitoring our data daily. As we've all known, with reopening would come increased cases, and we're certainly seeing this now. As the governor has said many times, the virus is still here, With these increased cases, we're learning every day how to live and navigate within this new normal. We must balance our physical, mental, and economic well-being. We must stay vigilant and prepared, and importantly, be aware that guidance will change as science progresses in how to deal with this virus. We must understand that with this increased socialization comes an increased risk of spread, and this is why personal responsibility is the key to stopping this virus. Our goal remains to continue to work closely with Oklahomans to continue expanding testing capacity, reporting transparent data, and informing the public as risks evolve. We encourage people to follow the CDC guidelines set forth. We ask our most vulnerable populations to stay safer at home when they're in the situations that needs to occur. Before going out or attending events, we should all ask ourselves 3 questions. Where are we? Who are we? And what are we thinking about doing? We must all engage in good individual and collective choices. We are part of our communities, Oklahoma, and our nation, and we must make choices that protect all of us, especially our most vulnerable population. Our public health professionals are working around the clock to identify cases and hotspots and responding with increased testing and support in those areas as needed. We're proud to announce today the launch of our COVID-19 risk assessment model. These levels are based on publicly available, critically important data and provide practical, actionable information to guide behaviors and mitigate spread. It's a tiered colored system similar to that of a weather warning system that communicates risk level and information at a county level. The intent of this alert system is to protect health and lives while enabling social and economic activity to resume in the different phases of the pandemic. It allows for additional information to empower citizens to make wise choices for themselves and their family. This tool will be also used for local leaders to guide their communities as they see fit. It'll be updated weekly at coronavirus.health.gov. And it's based on a tiered system that has triggers based off of percent of numbers per 100,000. And it's a 7-day rolling average to get that information. Governor?
Thank you, Commissioner. As I said earlier, I'm calling on all Oklahomans to do their part to slow the spread of this virus, protect our friends and our neighbors. As your governor, I'm going to protect our freedoms as Oklahomans, but I need your help in this. Take the personal responsibility to protect yourselves, your family, and our most vulnerable. Continue to wash your hands frequently, stay home when you're sick, maintain physical distances, and consider wearing a mask in public when maintaining physical distance is not possible. Oklahomans did a really good job back in April to flatten this curve. March and April, we issued 25 different executive orders, and we did a really good job of flattening the curve. We need to continue to take this very seriously to protect our lives and our livelihoods. I also want to update you on where we are with the unemployment claims in our state. We are months and months ahead of other states. We've been fully open now for the past 39 days, and we started our reopening plan 77 days ago. And we're starting to see some really positive trends in our data. Last week, initial unemployment claims in our state fell to the lowest levels since March. I know some Oklahomans are still hurting, and my heart goes out to them. The staff at OESC has been working long hours, helping hundreds of Oklahomans get their claims processed. They've made tremendous progress in this. And at this time, I'd like to invite Shelley Zumwalt, our Interim Executive Director of OESC, to give us an update. Director?
Thank you, Governor. And thank you for allowing me to provide an update on OESC. As many of you know, we've had a really busy week. We've been serving hundreds, if not thousands, of people at our events that we've had in Midwest City at the Reed Center. We've had more than 500 people each day attend the events, and we've served over 3,000 claimants while making safety for those who attend a top priority. Guests who wished to see a claims agent had their temperature taken at the door, were screened for exposure to COVID-19 before they entered, and were asked to wear a mask at the event. Some of the reasons why people came to the events ranged from answering one or more questions in the weekly attestation wrong, or providing identification to remove a fraud stop on their claim. Others had never received their way to go cards from our vendor Conduit, and we required Conduit to be on site at these events to help these claimants. They provided overnight tracking for the claimants that arrived there and made sure that they got their cards in their mailboxes when they applied. We also saw many people who did not have strong computer skills, and others who said it was their first time to ever work on a computer. These are significant issues that impede a person's ability to find success when filing for unemployment, and something that the agency is actively working with OMES to identify possible solutions to, as most of the application and the weekly attestations are online and require the applicant to successfully navigate the system. Another benefit to seeing thousands of people at these claims events is we're also freeing up the phone lines so other claimants who can't attend the events in person can have an easier time getting to speak with a call center agent. By eliminating 3,000 people from the call center queue, we're allowing others to find success with their claims, since we've moved all Tier 2 agents to Tier 1, and we now essentially just have one tier for all agents. We've seen our first call resolution numbers increase by 30% during my tenure at OESC. And yesterday, 50 new call center employees started their 8-week training to become call center agents for the agency, and we have 50 more that start their training in 2 weeks. Another issue that the agency has devoted significant efforts to is fraud. Over the last 2 weeks, OESC has worked with our card provider and vendor, Conduit, to analyze trends in unemployment and insurance fraud. The results of that effort yielded 2 changes which have already shown their value. First, all claims payments are being reviewed at an elevated level. This includes additional verification of the identity of each claimant and an analysis of the specific financial attributes of each transaction. These reviews may result in a delay of up to 24 hours for ACH payments to be paid via direct deposit, and this change was announced to the public and claimants earlier this week by the agency. Second, in order to deposit payments into another financial institution, we are now requiring claimants to provide the CVV code from the back of their debit card. Previously, this was not required for direct deposits. Claimants with existing direct deposits will not be impacted by this change, but we feel that this will help to ensure that we are tackling elevated levels of fraud. These 2 changes have already identified in excess of 85,000 potentially fraudulent transactions. The funds associated with those transactions are now being redirected to legitimate claims to better serve the residents of Oklahoma. While there's still work to be done, the agency has steadily been becoming more successful in managing the historic number of claims that the agency is processing. When I arrived at OESC as interim director, there were 129,000 pending UI and PUA claims at the agency. I'm happy to report that this week there are around 7,000 claims pending in the system. This is a healthy amount of pending claims, as having 0 claims is not the goal for the agency. In addition to the pending claims, we also have around 40,000 claims where the applicant has never completed their basic information in the system, and the claim looks abandoned to our system, or the applicant has completed the basic information but has never filed a weekly attestation. The agency is in the process of reaching out to these people to see if they are indeed legitimate claimants who just had trouble in the system, or these are people who started an application and didn't finish because they weren't eligible or found other employment quickly. The agency has had to quickly scale up resources and rely on agency partnerships to meet the increased need the citizens of Oklahoma have required during the pandemic. Since March 1st, OESC has processed approximately 700,000 UI and PUA claims and paid out over $2.1 billion in unemployment benefits. The agency has also been extremely busy serving the citizens of the state by approaching how we work with claimants to solve their issues on multiple fronts. We've done this by adding call center agents to answer questions and help process claims over the phone, by holding large in-person events to give our claimants reassurance through one-on-one and face-to-face interaction that we will not only solve their problems, but we will also give them training on how they can navigate the system independently so they can be successful in receiving their benefits on a regular basis. Again, there is still much work to be done, but the agency has been successful by approaching this challenge of helping so many by offering avenues to success on multiple fronts. And we will continue to approach how we provide value to the state and her citizens as a unique opportunity to serve and help so many during this unprecedented time in our state's history. Thank you.
Thank you so much, Shelley. You're doing a fantastic job. Appreciate you. So we've tested now over 10% of our population. So we've tested over 400,000 Oklahomans, over 18,000 positive cases, but something that sometimes gets lost, we currently have around 4,000 active cases in our state. We're still, in our total number of positives, we're the 43rd per capita lowest cases in the nation. So I'm so proud of Oklahomans. Again, we're months and months ahead of other states. We've been fully reopened for the last 39 days and started our reopening plan 77 days ago. So we have to continue to do our parts and take this very, very seriously. And so that's what I want to remind Oklahomans to continue the social distancing, continue physical distancing. Elderly population have to be very, very cautious because that is the population, like we've focused on the entire time, that are most vulnerable. So with that, we'll just open it up to any questions you have. We also have Secretary of Health, Kevin Corbett, in the room as well. Yeah, we've got, and I'm going to let Colonel Frye get into the details with you, but we have about 1,000 ICU beds available. They don't staff them all at any one time, so it's all flexible as we need them, but we track that on a daily basis, ICUs and hospitalizations, and so we have that capacity. And so the answer is no, we're nowhere close to the capacity at this time. We have 186 people in the ICU across the state of Oklahoma. And when you look at our active cases and you look at our hospitalizations, we would have to go to something like 2,000 positive cases a day for a 14-day period to start approaching those ICU bed capacities. And so we're gonna have plenty of runway if we needed to pull some of these levers and watch that grow. So Colonel Frye, do you have anything you'd like to add to that?
That was actually a very good explanation, but we still have contracts in place to help with overflow for COVID patients, and we're still not at capacity. I mean, it was a very good explanation. They report based on staffing every day, so there's two numbers, and that's what gets confusing to everyone. There's a number of licensed beds, so we know how many each facility is supposed to have. And then there's a number that they report, so that what you see every day is based off of their reporting, and not every hospital reports every day. I think our percentage was in the 80s today. So it's based off of reporting, and that reporting is also based off of their staffing for the day. So hospitals like to run as close to 100% capacity as they can at all times. So they flex staffing based on that.
Concern. I think there's about 6 hospitals in Oklahoma County right now that are at capacity when it comes to the ICU beds. Is that not really a concern then? That's what it's supposed to be?
I've been in close communication with them. I've spoken to the Oklahoma Hospital Association and many of the CEOs. they like to function around there. And again, those reports that they're giving to us every day is based off of their staffing for that day, not the actual number of beds that they have. Sometimes hospitals have been cohorting patients in those areas as well. That's why you have ICU numbers that are a lot more people in the ICUs than ventilators sometimes, because they try to keep all the positive patients in the same area of the hospital. So we still have room.
If you could help me understand what I'm looking at on this assessment. Because as of July 8th, we've just had a lot of spikes, but it's showing that most of the state is at low risk. Areas with high spikes are labeled new normal, and there's not any high at all. So first of all, how is that possible? And secondly, like as a business owner, what am I supposed to glean from that when it looks like most of the state's at low risk?
We base this off of the recommended levels that came out of Washington, D.C. for our state for going through the different levels of the response. Red is on there for when hospitals are close to being out of capacity. So if they are reporting that they don't have enough days of PPE on hand, or they're running out of their ICU beds, or there's several key factors that they're looking into to trigger that red. So right now, none of those are in red. That doesn't mean that there aren't areas of the state with higher numbers and numbers per 100,000 than other areas.
Dr. Pearl, Commissioner, you said earlier that personal responsibility is key to stopping the virus. As Commissioner of Health, is Oklahoma's mission to stop the virus, or is the mission to mitigate the death toll over the next year until a vaccine is publicly available?
Well, I would love to stop the virus. Yes. Do I think that the virus is in Oklahoma? It's going to be in Oklahoma until we get a vaccine? Absolutely. But either way, the way to reduce the risk of it is to take personal responsibility, not just for yourself, but the people you're going to be around when you go home or you go to see your grandparents or whatever else. You have to think about our collective responsibility as well.
Thank you.
Mine is for the governor. So you're telling people you keep telling us to keep, maybe getting these press conferences like once a week, and we just keep telling people to, we're monitoring the situation. They're supposed to check this before they go outside. So right now it's just totally on Oklahomans to kind of figure it out, is what I'm hearing. So it's what are you doing? I mean, you keep monitoring, you're talking to the hospitals, but are we continuing to just say we're monitoring the situation and everything is manageable?
And basically, again, I think Oklahomans, and I've said it in every press conference, I feel like we've done this better than any other state. I'm so proud of Oklahomans. What my job as governor is to be as transparent as possible, give the data to Oklahomans, and then give people the freedom to react and run their businesses and protect their health and their families the way that they see fit. So the orange level, so this is a direct answer to your question. On the orange level, 14.1 or 14.2 cases per day for a 100,000 person population would get you to orange. So if there's no orange on there, that means we don't have 14.1 per 100,000 population per day on a 7-day average. So that's how you get to the orange level. The yellow level is between 1.4 to 14. And then the new normal, the green, is just 1 case per 100,000 per day on a 7-day average. So what I'm trying to make sure Oklahomans understand is this virus is going to be with us for a while. We have to learn to deal with it. We have to learn to protect ourselves and our family and kind of readjust how we socially interact with people. And we're seeing Oklahomans do that very well. So we'll continue to provide updates. I'll continue to make sure that we coordinate transportation on ICU beds, and we use the entire state's assets and resources to make sure that no one hospital gets overloaded or gets overrun. But we're not gonna start and stop our economy unless we see some catastrophic issues with our healthcare authority going up to the red level. So I'm going to continue to be transparent with Oklahomans, continue to give them the data, and then give them the freedom to make those decisions to protect themselves and their families.
Governor, a lot of school districts right now are in the process of developing back to school plans. First, how confident are you that schools are going to be able to open up on time this fall? And Second, do you support kind of the mixed virtual in-person lesson plans or procedures that some districts are putting in place? Or just what are your thoughts on schools?
Yeah, so I'm really strongly encouraging Joy Hoffmeister, all the local school districts to reopen in the fall. And again, this is a personal choice. There's parents can choose to put their kids in online. There's a lot of schools that are offering that. We're trying to get our technology set up. That's why rural broadband is such a huge effort for my administration, is to make sure that every kid, every school district has access to be able to learn digitally. So we want them to be. We want our schools to start in the fall, and we know we're going to put some contingency plans in place that if there is any kind of outbreaks in the schools, that they can do some online learning as well.
Governor, could you give us your reaction to the Oklahoma decision released this morning by the Supreme Court?
Yeah, that just came out, I believe, at 9 o'clock Central. We're still digesting that. We've been in contact with the Attorney General, and Mithen, his first assistant, gave us a briefing on that a couple days ago. And so we're still digesting that information. It's going to have, obviously, with the criminal cases, it's going to have an impact on Oklahomans, but it's also a pretty narrow opinion that could have other implications for the state of Oklahoma. So we're still monitoring that and still talking to the experts to see exactly what that means for the state of Oklahoma.
You're a Tulsa guy. Tulsa, partially being within the boundaries of Skokie Creek Nation. Have you heard from some of your fellow business folks and leaders back in Tulsa County about this?
No, it's so new. Obviously, we're trying to figure out what does federal prosecution mean, and the state does not prosecute certain crimes. Does it stop on the prosecution of crimes, or does it move into taxations? All those questions are things that nobody really knows at this point. I was with Senator Langford earlier today. This is a federal issue. It's something that the Congress needs to address. To put some parameters and see exactly how we're supposed to deal with this.
Are putting in place mask mandates or some other kinds of restrictions? Are you still in line that you will overrule or make any attempt to overturn any local restrictions in the state?
Well, first off, we've never been heavy-handed with local mayors, local municipalities. We believe that. We believe in local control. Furthermore, the state, without some drastic measures, would not have the authority to come in and remove restrictions from a local authority. Local authorities can always be more restrictive than the state, but every community is different. That's why we're putting the map out with the green, yellow, and the orange, so we can see where we're at county by county in our populations and the positive cases per 100,000 in every county. So, of course, I've been very clear, I'm not comfortable with mandating masks, and so municipalities that mandate masks, it's not something that I would do. I think that the first question when you mandate something is how you're going to enforce it, and we just think that you can't go down that road, and so I'm going to protect the freedoms in Oklahoma. We're not going to mandate in the state of Oklahoma, and we're not going to be mask shamers either.
But you wouldn't make any effort to overturn a local municipality's mask mandate?
At this time, I'm going to support our municipalities and local control, and that's up to the people in those municipalities and those communities to dictate what they think is best for their communities. But again, I'm personally, as a state, we're not going to mandate masks as a state. We have not dug into whether the governor even has the power to go in and undo some additional restrictions county by county. So it's something that we never thought we would have to do, and I know that there's some questions with some municipalities being a little bit more restrictive than the state, and we're monitoring that. And but from a state perspective, there's not a one-size-fits-all, and we're certainly not going to mandate masks statewide.
Thanks, everybody.